Dr. Allyson Shrikhande. I am the co-founder and chief medical officer at PRM, or Pelvic Rehabilitation Medicine. And we specialize in taking care of patients with pelvic pain and endometriosis in a multidisciplinary fashion. And we serve patients who often have been suffering for many years. Average, it's anywhere from 7 to 12 plus years of symptoms, and seeing 8 to 10 other professionals before finding PRM. So with endometriosis, the symptoms really can vary from patient to patient. And why is that? Let's talk about the definition of endometriosis. So endometriosis is a systemic inflammatory disease process. And what it is, it's when there are cells that are similar to the lining of the uterus are found outside of the uterus. But they can be found in many different areas. They can be found around the bladder, they can be found around the bowel, around the fallopian tubes and ovaries, right? And they can travel to, the diaphragm, right? It really just depends on where these cells are as to a lot of times the symptoms that each individual patient would present with. The most common symptoms we see would be a lot of GI symptoms, right? A lot of lower abdominal pain, bloating, constipation, sometimes pain with bowel movement. Sometimes during your menstrual cycle, there can be some blood in your bowel movement. Bladder symptoms, if it goes to the bladder. Urgency, frequency, burning, sensation of a UTI is common, and also around intercourse, a lot of discomfort with intercourse, pain during intercourse, either superficial or deep. Sometimes it's a soreness or a flare after intercourse. It can be a flare even wherever your pain is, if it's a bladder flare or lower abdominal pain flare. It just really depends on the patient. So a symptom tracker, why use it, right? It can help provide structure and consistency with tracking and real data, right? When you use it consistently, over time, you can look back and really analyze the data. As endometriosis has a multitude of symptoms, one common symptom of endometriosis does include quite often pain around your menstrual cycle and pain with menstruation. So this symptom tracker for endometriosis can be very useful when you are seeing a provider and you want to talk about your period pain, pelvic pain, potential endometriosis symptoms. It's a nice way to clearly present data on your individual personal symptoms that you're feeling. As a provider, if a patient comes in and they've been using a consistent symptom tracker, it is extremely helpful because it just provides a very clear understanding of a patient's symptoms, of the severity, of the timing. Sometimes it's around your menstrual cycle, sometimes it's around ovulation instead, and sometimes it's not associated with either ovulation or your menstrual cycle, but it's important for us to understand the symptoms. I would encourage patients to use the tracker to advocate for yourself, prepare for your visit with your provider, and overall really give you better overall health. If you're a patient out there who's been struggling with period pain, pelvic pain that's been unexplained, I would suggest using the tracker, and it can really help advocate for you and connect with your provider.